My name is Dr. Hillel Mazansky, specializing in medical hypnotherapy, guided visualization, nutrition and exercise, my website being drmedicalhypnosis.com. Today I'm going to discuss a psychological illness called depression. This is extremely pervasive in our society and in the Western world. Acute depression, such as the loss of your job, the loss of your partner, uh, any acute loss, the loss of a pet, that type of depression lasts for a while and then usually dissipates as time goes on. This is not the type of depression that we're going to discuss today. The type of depression is chronic, ongoing depression. And there are three types: major depression, bipolar depression, and seasonal affective disorder, or more commonly known as SAD, very aptly known as SAD, seasonal affective disorder. Let's begin with major depression. If a depression lasts longer than 3 to 6 months, it is called major depression. The signs and symptoms of which patients suffering from depression are extremely tired, they don't want to do anything, they would rather just lie in bed all the time. It is so difficult for them to even get out of bed. They ruminate a great deal about the depression, thinking about it. And this type of depression can be lethal in that this is the main cause of suicide. We are seeing now that it's not only adults who suffer depression, but it's teenagers and young children, especially obese children. The standard treatment for depression is antidepressants, and a lot of them have a side effect in that the suicidal rate from taking antidepressants is increased. Counseling also helps. If counseling and antidepressants don't help, your next line of defense is hypnosis. Because during the hypnosis session, we are able to penetrate the subconscious mind, and oftentimes that's where the major depression stems from, the subconscious mind. Whether it's trauma from childhood or severe trauma later on in life, the depression manifests itself. Usually with therapy, they are unable to penetrate your subconscious mind. How many times I have heard the story from those that we have treated that the patients went to their psychiatrist or psychologist and all they did there was sit and listen and didn't give them advice. I'm not decrying them. My suggestion is, if you are depressed, take care of it. The problem is that people who are depressed resort to alcohol and abuse alcohol and drugs. They look for anything that will give them some relief of their symptoms. When they are unable to tolerate it anymore because the pain is so severe, they take their lives. Bipolar depression, on the other hand, does not respond to hypnosis. Bipolar depression is when people have mood swings. For some time they're up and they live an exorbitant life of spending money recklessly. They tend to do reckless things. They purchase things that are basically of no value, and sometimes they never even use it. And then when they crash, they become severely, severely depressed. As I said, hypnosis doesn't help bipolar depression. They usually respond to various medications that your psychiatrist will, or your psychiatrist will prescribe to you. The last type of depression is called SAD, seasonal affective disorder. That comes during the winter months, and when the days are short and the sun doesn't shine, that affects people, and they have seasonal affective disorder with depression. As soon as the summer months come, the depression usually lifts. Let's talk about other treatments that you can do so that you may be empowered to help yourself with your depression. The first and most important thing that I can recommend to you is exercise. Now, I know some will tell me that they are so depressed they cannot get out of bed. My suggestion is force yourself to get out of bed. Do not allow the depression to dominate you, because then you have lost power. Empower yourself by fighting the depression. Get up and exercise. It is mainly cardiovascular exercise that can help with your depression. The more you exercise, the more endorphins are secreted by the brain, and those are the feel-good hormones. Nutrition is also of importance. Not only eating a highly nutritious diet, but omega-3 fatty acids in large dosages have been purported to help people with depression. Then there is SAD. As I said, seasonal affective disorder. This type of depression responds tremendously well with the use of a blue light. It is a special light that you sit in front of the light for an hour or hour and a half a day, and that substitutes the sunlight and makes you feel better. Some depressives who have difficulty in sleeping, some sleep too much and others cannot sleep. For those who cannot sleep, my suggestion is to also use this blue light. Help is available. Try and use the help. Those who want to do it holistically, exercise, nutrition, and medical hypnosis and guided imagery, there's a special video on our website, drmedicalhypnosis.com. Empower yourself to help yourself with depression. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.